I have witnessed thousands of hearts stop beating right in front of me on the operating table. But what has stayed with me the most after more than 20 years in this field is not fast food, not smoking, but something far more unexpected. It is the very medications patients trust to keep them alive, quietly weakening their hearts day after day. My name is Dr. Michael Harris. I am a cardiothoracic surgeon, and for over 2 decades, I have operated on patients who reached the point where surgery became their only option. And over time, I began to notice a pattern that I could not ignore. Some of the most serious damage I have seen was not caused by lifestyle or genetics. It came from combinations of medications, prescribed with good intentions but never fully examined together. After the age of 60, your body changes. Drugs stay in your system longer. Your body processes them more slowly. Yet, this is also the time when most people are taking more medications than ever before. The average person over 65 takes 4 or more prescriptions every day, each one approved on its own. But almost no one asks what happens when they all interact inside the same body. Let me introduce you to someone. I will call him Robert. 74 years old, a retired construction supervisor, disciplined, careful, he did everything right. He stayed active, ate well, and took his health seriously. But when he came to see me, he was exhausted, not just tired. Exhausted in a way that sleep could not fix. His muscles cramped at night. His thinking had slowed, and every doctor told him the same thing. This is just aging. When I reviewed everything he was taking, it took me less than 5 minutes to see the real problem. It was not one issue. It was several happening at the same time. After the age of 60, something subtle begins to change in the body, and most people are never clearly told about it. Your kidneys no longer filter as efficiently as they once did. Your liver slows down in how it processes chemicals. Medications that used to pass through your system quickly now stay longer, building up in ways that are easy to overlook. At the same time, this is when prescriptions begin to multiply. One for blood pressure, one for cholesterol, something for sleep, something for pain, something for digestion. Individually, each of these medications has been studied, tested, and approved. But very few studies look at what happens when 4, 5, or even 8 of them are taken together every single day, inside a body that is already changing with age. This is what we call polypharmacy, and it is far more common than most people realize. Now let's start with something most people never question. A medication that does not even look dangerous. Proton pump inhibitors. You may recognize the names. Omeprazole, pantoprazole, lansoprazole. These are medications millions of people take daily for acid reflux or heartburn. Many have been taking them for years. The common belief is simple. Reduce stomach acid, reduce discomfort. Problem solved. But the body does not work that way. Stomach acid is not just there to cause heartburn. It plays a critical role in absorbing essential nutrients, especially vitamin B12. When you suppress stomach acid for long periods of time, you also reduce your body's ability to absorb B12. Not slightly, significantly. And B12 is not optional. It is essential for maintaining healthy nerve function, mental clarity, and most importantly, for regulating a compound in your blood called homocysteine. When homocysteine levels rise, they begin to damage the inner lining of your blood vessels, increasing cardiovascular risk over time. But it does not stop there. Long-term use of these medications has also been linked to low magnesium levels. Magnesium plays a key role in maintaining a stable heart rhythm. When levels drop, patients may experience muscle cramps, irregular heartbeats, and that deep, persistent fatigue that never quite goes away. This is exactly what I saw in Robert. His energy had been declining for months. His nights were interrupted by muscle cramps. His thinking had slowed just enough to worry him, but not enough for anyone else to take seriously. On paper, everything still looked normal. But when you step back and look at the full picture, the pattern becomes clear. If you are taking one of these medications long-term, there are two simple questions worth asking your doctor. Have my vitamin B12 levels been checked recently? And what about my magnesium? Not to stop the medication abruptly. That can make things worse. But to understand what your body might be losing quietly in the background. Because sometimes the problem is not what you are taking. It is what your body is no longer able to keep. Now let's move to something even more surprising. A supplement that millions of people take every single day, believing it is protecting their health: calcium. If you are over 60, there is a good chance you or someone close to you has been told to take calcium for bone strength. It sounds logical. Strong bones need calcium, so more calcium must be better. But this is where things begin to shift in a way most people are never told. When calcium comes from food, your body absorbs it slowly and uses it where it is needed. But when it comes from supplements, especially in higher doses, it enters the bloodstream all at once as a concentrated surge. And your body does not always know what to do with that sudden increase. Without enough vitamin K2 and vitamin D3 to guide it, that calcium does not consistently go into your bones. Instead, some of it begins to settle in places it should never be, including your arteries. Over time, this contributes to a process known as vascular calcification, where blood vessels become stiffer and less flexible, more like rigid pipes than living tissue, increasing the risk of cardiovascular problems. This is sometimes called the calcium paradox. A supplement taken to support bone health may, under the wrong conditions, be affecting the heart. The goal is not to stop calcium abruptly, especially if it has been recommended for bone density, but to make sure the system is complete. If you are taking calcium, it is worth asking whether vitamin K2 and vitamin D3 should be part of that same plan. Because in the body, nutrients rarely work in isolation, they work together. Now let's talk about a medication that is actually designed to protect the heart: beta blockers. These are commonly prescribed for blood pressure, heart rhythm issues, and after cardiac events, and they can be very effective. They reduce the workload on the heart by slowing the heart rate and lowering blood pressure. But in some patients, especially as the body changes with age, the effect can become stronger than intended. The heart rate slows more than necessary. Blood pressure drops lower than ideal. And what patients experience is not relief, but a persistent sense of fatigue. This was another piece of Robert's story. His energy had been fading gradually, even though his habits had not changed. He was doing everything right, yet he felt like he was running on half capacity. When we reviewed his medications, it became clear that his treatment was working, just not in balance with what his body needed at that stage. This does not mean beta blockers are harmful. It means they must be adjusted carefully. If you are taking one and constantly feel low on energy, it may be worth asking whether your current dose is still appropriate. Because sometimes the goal is not to remove the medication, but to bring it back into alignment with your body. Now let's move to something that almost everyone has used at some point, and many people rely on regularly without a second thought: over-the-counter pain relievers. Medications like ibuprofen, naproxen, and diclofenac are so common that they rarely feel like a risk. They reduce pain, reduce inflammation, and help people stay active. On the surface, that seems like a clear benefit, especially for joint discomfort that becomes more common with age. But the way these medications work inside the body tells a more complicated story. NSAIDs block enzymes involved in inflammation, but those same pathways also play a role in protecting your blood vessels. When that protection is reduced, blood vessels become less flexible and more prone to constriction. At the same time, regular use has been shown to slightly raise blood pressure. That increase may seem small, but over time, especially in older adults, it adds up in a way that increases the risk of heart attack and stroke. This is exactly how something that feels harmless can quietly shift risk in the background. In Robert's case, he had been taking a common pain reliever almost daily. It helped him stay active, but no one had stepped back to ask what that consistent use might be doing to his cardiovascular system over time. The goal here is not to eliminate pain relief, but to be more precise about how it is used. In some cases, topical forms can provide similar relief with far less systemic impact. In others, alternatives like omega-3 fatty acids or curcumin may help address chronic inflammation in a way that better supports long-term heart health. Now let's talk about one of the most widely prescribed medications in modern medicine, statins. These are used to lower cholesterol and reduce cardiovascular risk, and for many patients, they are absolutely appropriate. They have been studied extensively and have saved countless lives. But like every medication, they come with trade-offs that are not always fully discussed. Statins work by blocking a pathway in the body responsible for producing cholesterol. But that same pathway is also involved in producing something called CoQ, a compound essential for energy production in your cells, especially in the heart and muscles. When CoQ10 levels drop, some patients begin to experience muscle weakness, reduced stamina, and a kind of fatigue that does not improve with rest. This was another layer in Robert's situation. He had been on a higher dose statin, and over time his energy levels had declined in a way that did not match his lifestyle. Again, the medication was doing its job, but something important was being depleted in the process. The question is not whether statins are good or bad, but whether the full picture is being addressed. If you are taking a statin and noticing persistent fatigue or muscle weakness, it may be worth asking whether supporting your CoQ10 levels could help restore balance. Because sometimes improving how a medication works in your body is not about removing it, but about replacing what it quietly takes away. Now let's move into something more complex. A medication that is often prescribed to prevent life-threatening events, blood thinners, specifically warfarin. This medication has been used for decades and plays a critical role in preventing dangerous clots, especially in patients with conditions like atrial fibrillation or a history of stroke. In many cases, it is not optional, it is necessary. But what often gets overlooked is how it works inside the body. Warfarin functions by blocking vitamin K, which is essential for blood clotting. That is how it reduces the risk of dangerous clots forming. But vitamin K is not a single-function nutrient. There are different forms, and one of them, vitamin K2, plays a very different role. K2 helps direct calcium away from the arteries and into the bones where it belongs. When that process is disrupted over time, calcium can begin to accumulate in the walls of blood vessels, contributing to arterial stiffness and calcification. This creates a situation where a medication that is protecting you from clots may over the long term be influencing another aspect of cardiovascular health. It does not mean the medication is wrong, far from it. It means the conversation is often incomplete. For someone like Robert, whose system was already under strain from multiple directions, this became another piece of a much larger picture. The right question in this case is not whether to stop the medication, but whether there are newer options available, or whether additional monitoring, such as imaging of arterial calcium, might provide a clearer understanding of what is happening over time. Now let's turn to something that seems even less connected to the heart sleep medications. These are widely used especially in older adults who struggle with falling or staying asleep. Some are prescribed, others are purchased over the counter, and many people take them for years without reconsidering their impact. The expectation is simple: better sleep leads to better health. But the reality can be more complicated. Many sleep medications work by depressing the central nervous system, when the syndrome system slowing brain activity to induce sleep. Over time, this can affect cognitive function balance and coordination. In older adults, this increases the risk of falls, but it also contributes to a subtle decline in overall resilience. When sleep becomes chemically driven, rather than naturally regulated, the deeper restorative phases of sleep are not always as effective as they should be. This has indirect consequences for the heart. Poor quality sleep, even if it appears longer in duration, is linked to increased stress on the cardiovascular system, higher inflammation levels, and less efficient recovery. In Robert's case, sleep had become inconsistent, and like many patients, the solution had been to add another medication rather than step back and reassess the underlying cause. Again, the issue is not that sleep medications are inherently harmful, but that long-term use without periodic reevaluation can quietly shift the balance in ways that are easy to miss. If you are relying on them regularly, it may be worth asking whether there are alternative strategies to improve sleep quality approaches that support the body's natural rhythms rather than override them. At this point, you may begin to see the pattern. Each of these medications serves a purpose. Each one addresses a real need. But when they are combined, especially over time, the effects are not always additive in a positive way. Sometimes they begin to take away as much as they give. Before your next appointment, there is one simple thing I want you to do. Write down every medication you are taking, every supplement, every dose. And at the top of that list, write one question: what am I losing? Because in my experience, after more than 20 years of working with patients at their most critical moments, the issue is rarely just the disease itself. More often, it is what happens quietly over time, when treatments are added, adjusted, and continued without ever stepping back to look at the full picture. Every medication has a purpose, but every medication also has a cost. And if no one is tracking both sides of that equation, something important can be missed. Statins may lower cholesterol, but they can reduce CoQ10. Proton pump inhibitors may relieve acid, but they can affect vitamin B12 and magnesium. Blood thinners may prevent clots, but they can influence how calcium behaves in your body. Calcium supplements may support bone health, but without the right balance, they may not go where you expect. None of this makes the medication wrong. It simply means the conversation is not complete without understanding what your body may be losing in return. Let me come back to Robert. After reviewing everything he was taking, I sat down with him and we went through it all carefully, step by step. We worked alongside his physicians, not against them, to adjust what needed adjusting and support what was missing. CoQ10 was added. His vitamin levels were addressed. Magnesium was introduced in a form his body could actually use. His plan was not replaced, it was refined. And over the following months, something changed. His energy came back. The nighttime cramps disappeared. His mind felt clearer. Most importantly, he felt like himself again. Now I want to be very clear about something. This story is not a prescription. It is not a set of instructions for you to follow on your own. Every individual is different, and what worked for Robert may not be appropriate for you. The purpose of this conversation is not to replace your doctor, but to help you have a better one. The medications we talked about are not the enemy. The doctors prescribing them are not the problem. In my opinion, the real issue is that modern medicine is incredibly effective at treating individual problems, but not always structured to look at how everything interacts over time in a single person. You may not be able to change that system today, but you can change the way you show up within it. You can ask better questions. You can understand your treatment more clearly, and sometimes that alone is enough to completely change the outcome. If this made you think of someone, a parent, a partner, a friend who has been told their fatigue is simply part of getting older, share this with them. Because sometimes it is not aging. Sometimes it is something we have simply not looked at closely enough yet. Your heart has been working for you every second of your life without asking for anything in return. The least we can do is start paying closer attention.